hope that you'll be able to join us. All right, so without further ado, I would like to invite our panelists to join us on the screen. Our moderator for today is Ron Horshevsky. He's a solutions consultant with Raider 8, and he's a former CEO of Concord Orthopedics and past president and board member of AAOE. So I am going to turn it over to Ron to get us started.
Melissa, thank you very much. So I'm joined today by an incredible panel that includes orthopedic leaders from across the country. But before introducing them, I want to thank the American Alliance of Orthopedic Executives for the help in putting this webinar together. And I want to challenge everyone who's listening to take a very close look at the AAOE Empower Data Warehouse. From patient-reported outcomes to benchmarking, the AAOE Empower was built to serve your practices. So the panel today includes some of the most respected leaders, and I'm going to give them an opportunity to introduce themselves. We'll start with Don.
My name is Don Schreiner. I'm the CEO for Ortho Illinois. I've been with Ortho Illinois for 21 years, and we have about 45, 46 physicians in Rockford, Illinois.
Thank you, Don. Lynn?
Good afternoon. My name is Lynn Pratt. I am the Marketing Communications Director at Ortho Illinois, and I've been working with Don for about 15 years.
Wonderful. Thank you. And Sammy?
Hi, AAOE family. I'm Sammy Spencer. I'm the CEO of Missoula Bone and Joint and Surgery Center in Missoula, Montana. We have 37 providers, and 14 of those are physicians.
Wonderful. Thank you. And Bill?
Good afternoon. Bill Sullivan. I'm the Executive Director of Orthopedics Northeast, north of Boston. We have 18 providers, 10 of whom are physicians. We also have rheumatology in our practice.
Great. Thank you, Bill. And Vicki?
Hi, I'm Vicki Sprague. I'm the Chief Integration Officer for AAOE, and I've been in that role for about 5 years, and I'm really working closely with the benchmarking survey and AAOE Empower.
Wonderful. Thank you. There's a couple of other folks that have joined on the panel that are from Raider 8. I don't know, Evan, did you want to introduce yourself? If not, that's okay.
Sorry, I was on mute, so you didn't hear background noise. Sure, I'm Evan Steele, CEO of Raider 8, and I'm just happy to be here and listen to this panel and try to learn some more about what's going on behind the scenes in orthopedics today.
Great. All right, well, thank you, Evan. All right, so we've got a number of topics to talk about today. I thought we'd start with a discussion about bundles. I'm going to direct a question right to Don from the start. Don, what does a practice need to have in place before it's ready to take on risk associated with bundles?
Well, to start with, you need case management, and you need physician involvement. So you can take on risk in various levels. The insurance companies will do something more of a gain sharing where you only have upside. That's a great way to start out to see if you're capable of generating a surplus based on a target price. But so I would say get into the game with gain sharing for sure with the insurance companies that have those kind of programs available to you: Humana, Aetna, Blue Cross Blue Shield of Illinois, and that's it for us right now. But once you get into those programs, and get some experience, we're also involved in the Medicare bundle payment program, and that was what launched us into the risk arena, if you will. We started that in 2015, and it's a little bit of baptism by fire in that you need to join the program and then set up a case manager and get experienced people to work for you. So in both that, we were able to do that immediately. So they're out there. You just have to get someone. So I'm kind of gonna just not get into it too deep, but I wanted to. That's how you get started with the insurance companies on gain sharing, and then get into bundles like a reliable, areas where you have a lot of volume. You want to have volume, and we did Medicare bundles with total joints, so we knew we had a significant volume.
So is the gain sharing specifically with the hardware, or is it in other avenues as well?
With the insurance companies, Ron?
Yes.
Yeah. They give you a target price, and if you can beat that target price and meet their quality measures, and you can, and generally the bundles include not just the hospital stay, but the home health therapy and all the other services that go on for 90 days after that. So you need to be able to identify and manage those patients as they come into your practice, and apply common case management principles and reduce your utilization in any of those areas.
Excellent. Excellent. So looking to the future, how do we see bundles evolving? I think most people dabbled their toes first in Medicare bundles to get good at it so that they could approach employers or even insurance companies. I'm curious if anybody's doing anything interesting with that. Sammy, what about at Missoula Bone and Joint? Is anything happening with that?
Well, we're still on the infancy of bundles. We just opened a brand new surgery center, just started doing total joints. We're a smaller market than Don and Bill. We only have about 100,000 in our immediate market. So we're just doing case rates right now for our surgery center, and not full bundles and no risk yet. But we did do the BPCI, so I think that does give you a lot of experience, kind of learning how to navigate the costs and what you need to look at before taking risk. What the case rates did for us, though, is that we were able to start negotiations with different payer groups that wanted bundles. They were happy with the case rates just to get the cost down and to steer to our surgery center from the hospitals, which was huge for us. With those discussions, what we were also able to do is do a carve out for the county, which is a big employer in our area, for our urgent care. So we were able to do that carve out. Their employees only have a $15 copay if they come to our urgent care instead of the emergency department, and they steer to us. We're listed in their benefits manual. They did health fairs, and it's a good incentive not to have to pay any deductible and only a $15 copay, and we get paid 100%, and they still save a lot of money. One of the statistics I just read is an average orthopedic emergency department cost is around $1,500, and ours is less than $300. So that's a big cost savings and a good way to negotiate with employer groups.
That's great. That's great, and I applaud your efforts through building the relationships through those case rates, so that you can advance to increase bundles down the road. Anything else? Anybody else on the panel want to comment on non-Medicare type bundles and relationships?
I think the biggest thing is to know your costs. I mean, at that you have to know what kind of hit you're going to take, but be able to get lower costs than the hospital so that you can get that steerage.
And that sounds, it sounds so easy that we would know how much a procedure costs, but it's so difficult. Any advice that, or experiential advice that people have in determining the cost of a procedure?
Yeah, I mean, when you're doing it, it's not just the supplies and the implants and the OR time. You kind of got to calculate that for each of your procedures that you're going to do a bundle for, and then of course you got anesthesia, and you've got some other administrative expenses, and then you profit margin, of course. And then if you want to do post-op, once the surgery's done, then you start have to, are you going to include home health care, PT, skilled nursing facilities, any of those things that you want to include in a 30 or 60 or 90 day bundle afterwards. Generally, it's usually the same day day of surgery, which is a case rate, or they do what I call a bundle, and that's a 90-day, you know, with all the other services included. So yeah, it takes time for you to go out and negotiate. You either provide the services yourself, you know, therapy, anesthesia, all those. We happen to have those in-house, but if you don't, you have to contract with those, and then of course home health and skilled nursing facilities we don't have. You have to go out and get those. So yeah, you get smart about it, and quickly. Again, your case manager is somebody that kind of leads that charge for you. Not only gets rates with them, but also gets their cooperation, because you're going to maybe get a couple SNPs, but you're going to figure out your preferred vendors, and they're going to work with you, and you work out that relationship, and you know, that they're going to notify you and keep you abreast of everything, and get permission before they do anything, and et cetera, and set up your own protocols. So yeah, that's part of the case management thing, is getting the relationship with the vendors, and managing the cost, I guess, and negotiating the cost. Long answer.
Oh, that's great. Thank you. So I guess, you know, Sammy, I think, brought up a really good point. You know, the size of the practice in the region that you work within are so important in determining the potential with bundles. So I guess I'm curious if any of you have advice for some of the smaller practices that might be a little bit challenged volume-wise. Should they consider bundles? Should they consider case rates, working with the community, with different employers in the region to get a competitive advantage, and basically have both quality and monetary savings be the driver for where patients go to get their care? It's got an open question to anybody who has that advice for a smaller practice.
Well, the smaller practice, I would say at a minimum that they should start working on a price transparency, which means you have to get a handle on your cost, and then you put that on your website. I say that, and we haven't done it yet, but we are going to do that. And if you can go on, you know, again, network. I've contacted a half a dozen practices that I know that do transparency pricing. I've looked at their website. We talked to them, and you know, that's how you learn. And you get that out on the internet. Get that on your website. What your price is for, you know, start with 10 procedures, or start with office visits, start with therapy, MRIs, anything that you can do. You know, explain it, and again, use somebody else's website, that you don't have to reinvent the wheel, and hire a marketing director. I'm just kidding, Lynn. But no, Lynn is a wonderful asset. We love having Lynn around, because she's great at all of this. But you know, if you don't have that resource, you can go out and get to know these other CEOs and other managers, and see what they're doing, and it's very easy to replicate. So that's a great way to get started.
Okay. That's another challenging endeavor. Price transparency. It's difficult to actually get your prices on websites, and I do applaud the practices that have been able to do that. I guess I wonder if there's an opportunity there for practices to do like non-surgical bundles, and have those listed as prices on their website as well. Lynn, do you have anything that you'd like to add with regards to price transparency and building volume through that transparency?
I think it would be very helpful, and as soon as we're able to actually, you know, finalize what kind of pricing we want to put out there and for which procedures or services, I can't wait to get it up. I know, you know, it's also a little bit of a patient dissatisfier when no one can tell them ahead of time what something is going to cost, because healthcare costs are a concern for most people. And so being able to be upfront and let people know what they can expect ahead of time would only be to the practice's advantage.
Great, great. Thank you. Anything else about bundles or price transparency before we consider transitioning to another topic?
I have a couple of things, Ron.
Sure.
We're talking about the future of orthopedics, and I think price transparency is huge with healthcare costs being so high. If you're not familiar, there's a healthcarebluebook.com where anyone could go. There's a free portion to it where you can see in your area what a low cost, average cost, and high cost is. And one of our payers, one of our local Montana payers, have this embedded into their website so their subscribers can go on and it will tell them where you sit compared to your competition for, say, a total joint or a carpal tunnel or whatever it may be. They can go look and see. And with healthcare costs being so high, I think it is super important that you know your costs, you know that you're competitive. The other thing that we're looking at to be competitive with this is there's a company called healthmedocs.com, and they do self-pay packages, and you can load that right onto your website. And we're looking at that. This will drive more of the self-pay patients to your group. And then more, this is geared a lot towards some of the alternative options for high cost health insurance, where we were looking at 24% increase for our health insurance next year. And so we were looking at alternative options such as a medical cost sharing program. I think a lot of us have seen like the faith-based ones, which is like Liberty Health Share, and I want to say MediShare. But there's 4 or 5 of them, and they have over 1 million members now. So these are patients that are negotiating as self-pay. And so if you can steer more of those patients to your group, you don't have to worry about pre-auth, you don't have to worry about billing insurance and getting denials and fighting for your money. So I do feel like this is the future. The other thing that we've done as far as price transparency is we have hired financial counselors who will get a cost estimate out to patients before their MRI, before their surgery. If they're having their surgery at our surgery center, they'll give them their cost estimate for that. And then we're collecting 50% up front, getting a payment plan in place so that people have their finances all taken care of before they have their surgery and they're trying to heal, and they don't have to worry about that. And that goes with that surprise billing. There's no, big surprise of what's coming. Now, we can't do that for anesthesia because that's a separate group. So we do connect them with them to get that estimate as well. But I think knowing your costs, being able to be competitive and get some of those self-pay patients steered to your group is going to be the future of orthopedics.
That's great. Sammy, thank you. Thank you very much. So great conversation about bundles, and of course costs are associated with that, price transparency. I think another factor that's really important if we're looking at bundles and cost containment and basically demonstrating improving quality would be patient-reported outcomes. So, Vicki, I know that you and the AAOE have put in tremendous efforts in building the AAOE Empower, allowing practices to measure patient-reported outcomes. I wonder if you could tell us a little bit about that tool that's been developed and how the average practice could use it to improve their quality measures and cost containment.
Sure. Let me go ahead and share my screen here too. So AAOE Empower was designed to be the single source of data for orthopedic practices. So the goal is to capture patient satisfaction and patient-reported outcome data in the same platform that we're currently collecting operation metrics. So it really allows us to expand the data that we have available, and patient-reported outcomes are such a core piece of that. So really the power in patient-reported outcomes comes through the bundles that you're looking at. How can we really improve the quality of care for patients while managing the cost? But also being able to compare your results to other orthopedic practices. So this concept of benchmarking is really important so that you have a context and a framework from which to compare how you're doing as a practice to other orthopedic practices in the country, and also to see how individual providers in your practice are doing, so you can continually look for opportunities for quality improvement, with the bottom line being, how do we improve the quality of care for our orthopedic patients? So within Empower, we are really intent on really capturing that data, however you're collecting the data. If you don't have a mechanism for capturing patient-reported outcome measures or patient satisfaction surveys, we want to provide that survey platform. But if you're using another system or vendor to collect those surveys already, you know, it's really intended to be a data warehouse, as you mentioned earlier, so that we can look across vendors and we can look across systems to have a single source, single location to look at, so you can really understand how you're doing as a practice in your community and then compare it to others. So as we look at this, you know, there's a lot of different patient reported outcomes. Obviously, we have a lot of different specialties in orthopedics, so we intentionally look for tools that are going to be very specific to different procedures, what, you know, regardless of lower extremity, upper extremity, or if you need something that's more global. So I know there's a lot of acronyms on this page, just showing you the breadth and complexity that we're facing when we're looking at patient-reported outcomes. There's a lot of different tools out there. So, you know, we try to provide a framework, a place to get started with outcomes. Obviously, this is a moving target as new outcome measures are evolving and we get additional feedback and participation. So continuing to look at these measures is important. I'm not going to spend a lot of time on these reports. Just know this is opportunity for you to compare your practice data to those industry averages and establish benchmarks. Couple different tools, couple different looks at how to do that. And then we also capture patient satisfaction surveys. Well, I'll have the slide up so you can see what we're doing with that as well. And again, just to give you an idea and some visuals of how we're doing that, all within the Empower platform. So, you know, happy to talk more about this if you would like. But that's just what we're doing with AAOE Empower. And again, just intending to be that single source of data for orthopedic practices.
It's really fascinating, and I applaud your efforts. I think that patient-reported outcome data can be used for so many different purposes, and it's so important. And that data really, I think, dictates our positioning in the future in terms of our negotiating with insurance companies, working with employers, just to demonstrate and differentiate ourselves from anybody that we might be competing with. I don't know, is anybody on the panel doing anything exciting with patient-reported outcome data that they'd like to share? There's...
Well, with our surgery center, we publish our stats for, you know, for surgery center bundles, if you will.
Yeah.
That go along with the pricing of it and everything. So yeah.
Yeah, and I've been successful in using the data when negotiating with insurance companies. It really helps to position a practice well when they can demonstrate that their outcomes are better than others, and basically, you know, showing significant improvement with the various procedures. So we're talking a lot about data and how it's driving the future of orthopedics. You know, looking towards other forms of data, I'd like to look at online reputation. So I'm at Raider 8. One of the things that I've learned and that has really kind of shocked me in some ways was just how many more people see your Google My Business type profile versus visit the website for a particular practice. So it's, you know, it's in multitude. So I mean, it could be like 5 times more visits to Google My Business profile than somebody who actually makes it onto the website to view for a practice. So there's a lot of data online for practices and for the providers that are within practices. So I guess I'm curious from the panel, are people managing that data? Are you trying to control that data, build positive data? Like, what are some of the things that you're doing to help manage that?
Well,
Lynn?
oh, go ahead.
I was just going to ask Lynn if she could get in. I get in, not into the details too much, but Lynn, if you could explain what we do. I mean, we're trying to keep 2 or 3 sites populated with our scores. So go ahead and you could explain how we do that.
Sure. For about 5 years, we've been really focused on paying attention to how consumerism has impacted the healthcare industry. And we knew that the reputation of the company and the individual providers played a huge impact in the new business that we were getting. Just tracking our referrals, we could see the migration from the traditional new patients coming from physician referrals to coming from friends and family referrals. So we really stepped it up and started measuring and actively trying to solicit patient reviews from our patients. So initially when we started out, we did it with baby steps, and it was a very manual process. We literally put a handout in the patient's hands asking them if they'd be willing to go online and do an online review about their experience that day. And then they would sign the form and give us their email address, and then I would email them a link to one of our providers' review or profiles on one of the review sites. We've certainly gotten a lot more sophisticated and a lot more successful with that effort by using a vendor. We are currently clients of Rater 8, and just the results in the volume of online reviews that we've gotten have been phenomenal. And key to anyone implementing this is having your providers buy into it. And that was a little bit of a learning curve for our doctors to kind of understand. But there were some pivotal things that happened that really opened their eyes to where they understood why it was important to manage your online reputation. We had some circumstances where patients were already booked with a physician because of a referral, and they would call back and ask to be switched to a different doctor because they read some online reviews and they wanted a different doctor. And we had another physician himself in the emergency room with a patient that he was on call and taking care of, and the patient said, "Oh, it's you. I've read about you, but I guess I don't have a choice now." And so little incidents like that where even the doctors realized that having one or two bad reviews out there is bad, but if you can counter those by having lots of positive reviews, it really diminishes the impact of those few disgruntled patients that are more actively inclined to go out and post negative reviews. So having any kind of formal program to build up your volume of positive reviews is only beneficial to the practice.
Great. Well, great. Sammy, thank you, Lynn. Sammy, you were going to say something earlier?
Well, I totally agree with Lynn. We didn't have any good examples like that, but what it took to get the doctors buy-in, I was trying to get a full-time marketing position in our group. So we started small, and we had a X-ray tech who had an interest in marketing, and so we just kind of groomed her, and now we do have her full-time in that position. But it took a lot. The doctors don't like to pay for marketing. They think, if you get a good experience for the patient, then the word of mouth is enough. But it's not enough. You do have to manage this reputation. And it took some statistics. There was something in orthopedics and spine market trend surveys that said 57% follow the doctor's referral, but 35% shop for their ortho surgeon, and shopping could be online or friends and family, like Lynn said. But lots of similar findings with that. 63% choose a provider over another based on online reviews. That's the statistic that got my doctors. They're like, okay, if they're going to pick our competitor over us because of one online review and we're not managing it, that could be a real problem. And that's the loss you don't even know about. You don't know that somebody made that decision because they read something online. And so that is a lost opportunity. So online reputation is huge. I also feel that you have to manage your reputation with your referring physicians and primary care. Sometimes this gets forgotten, especially for us. So our marketing specialist does watch the referring physician trends to see if anybody drops off, looks to see, did they retire, did they move, what's happening. We reach out to them, and we found some people had a hard time getting through to our office. So we created a special line, just a lot of different feedback. But if you're not watching your reputation, whether it's online or in your community, then you could be losing referrals.
So very interesting. So that line that you created, that was like is that a hotline from a PCP office to your office? So if they had an urgent patient, they could get them in right away?
Not even, it doesn't even have to be urgent. We just wanted to make it easy for them to refer. We also, they can do it on our website. We just have a little button on the website that says refer a patient, and they can go on there and refer the patient, and then we call them. So we try to make it as easy as possible.
Great, great. What about you, Bill?
Several things. I agree with everything that's been said. One of the things that we ran into is we found out that we had miscellaneous listings on Google, and cleaning that up was a process, to put it mildly. They actually mail you a code, which is odd for Google, that you have to respond to. But we found, for example, even recently, we found a physician somehow attached to our practice that doesn't work for us. So I think in this whole process, the thing that I would say is that there's some cleanup work that you may run into that until you start digging into this, you don't even know you have the problem. The second thing is our docs were pretty fast to come on board, but we've also found that just the sheer volume of the responses gave our operations, and I think Sammy was kind of leaning into this, but some really quick feedback and guidance as to what's working and what's not working. And so I would say, while we've benefited certainly from having positive reviews and lots of them, and being able to populate not just Google, but some of the other sites, the feedback, the instant feedback that you get from the patients is really good. And sometimes the negative review is a warning shot across your bow that something needs to change, and change quickly, or at least be evaluated. So we, for example, watch it all the time. Every month, we put up the previous month's comments in the lunchroom for everybody to see, good, bad, or indifferent. And it's really kind of, I think, focused the practice and pushed our culture a little more forward than it was.
Excellent, excellent. So Vicki, I don't know, I know the AAOE Empower has a patient satisfaction tool with it, and that there's some data sharing between Rater 8 and AAOE to kind of, can you tell us a little bit about that?
Sure. You know, obviously you're using vendors for social, like Rater 8, for social reputation management, and there's a service that goes into that. It's not only collecting that patient satisfaction data, but then it's working with you to really manage the social reputation for your practice. And, you know, that's really important. So when we look at the vision for AAOE Empower, it's really to capture the data, the satisfaction data, and then provide that benchmarking opportunity, regardless of what vendor you might be using to capture that satisfaction data. So what we've done, and we're working with a variety of different vendors in different areas, including patient-reported outcomes, is to capture that data in one central location, regardless of how the survey data is collected. So for example, with Rater 8, the completed surveys are connected or transferred over to us just with simple signing of agreements and agreement, you know, approval for Rater 8 to send that data to us. So you don't have to feel like you have to do two separate data collection processes, nor should you do that with your patients. You want to ask them the question one time and then have the data used for multiple purposes. So that's really the power of connections like that, and really the power of having a platform like AAOE Empower that can data warehouse all of that information and really leverage the data, look across the different types of data, and really get to some advanced insights that we can use to improve our practices, improve our market position, and really leverage all the information that we're using for the goal of improving the quality of patient care.
Great, great, thank you. Any other comments that folks have? It seems like a lot of this conversation is around, you know, managing expenses, you know, managing costs, providing great quality while doing it affordably for either insurance companies or for employers. So it's really a fascinating topic, and it all gears around numbers and data. A lot of that data can live right in that AAOE Empower. Any other comments on this before we might transition to a different topic? Okay, great. Very interesting conversation. So this all kind of leads towards having the rules and regulations set up in a sense that would favor us in the orthopedic world. which makes me think about advocacy. You know, going to our state and federal leaders and advocating for what we need to be successful. And you can define success in a number of different ways. You can say, success is delivering high quality care at the lowest possible price. I think that's what we probably all could agree on. Looking at advocacy, I wonder, what should we in the orthopedic world be advocating for right now with our political leaders?
Well, right now we've got a letter writing campaign going on to not make the reverse the cuts.
Yeah.
So
Yes.
that's important.
Yes. So just for everybody listening, can you tell us a little bit about those the campaign? Should somebody be doing something if they're not doing something right now? So
Yeah.
you're saying, reach out to your congressmen and senators about the Medicare cuts that have happened specific
Right.
to the orthopedic world.
Right. Well, I mean, right now I'm monitoring that. There's I think 83 or 88 sponsors right now for the bill to cut that. So if you're writing letters or making calls or whatever, keep it up. It's having a good effect on getting some momentum on Capitol Hill. So we're
Yeah, and an easy way to do that, AAOE worked with AOS, who put out an action alert for this. Yeah. So it makes it really easy for you to sign either on behalf of your physicians, or you can forward it on to employees in your practice. You can complete that action alert if you need the link resent to us, but look at your inbox, and it's also been posted to Collaborate. Makes it really easy to really communicate broadly that, what our position is against those fee cuts, and really help partner with AOS to make sure that they have the presence on Capitol Hill to push those forward.
That's exactly what we did. We pushed it out to everybody in the practice, well, all the surgeons in the practice. I didn't think about the employees. That's a good one. And I mean, it was honestly less than 1 minute of effort, assuming your screens auto-populate, and it went directly to the correct party in Congress. It was truly effortless.
Right.
Yeah, that's what we used also. It's fantastic stuff. You can hit 2 to 4 political for your whole organization, for all your positions in a matter of, half hour, 45 minutes tops. And for us, it's a little longer because we have a lot of providers, but it's slick, very nice.
Right, and I see that we just posted the link to that action alert in the chat, so take a look there if you haven't seen that.
And my limited experience in this is that loud voices get heard. So who knows what is ultimately going to happen, but the converse is also true. I know exactly what happens when things are silent.
And earlier Sammy was talking about building relationships with payers and how that can be helpful in terms of a negotiation. I would also just encourage everybody to build a relationship with your congressperson, senator. You have that relationship, you can pick up the phone, or you can shoot an email, even if it's just to one of their liaisons in the office. It can be very impactful if you have that relationship, just to reach out and nurture that relationship. I think one thing that's often forgotten is that you can be a resource for them in their office as well. So sometimes they have questions and they might not understand the impact, to let them know that, hey, if you have a question about something, call me and I'll help you. And that helps to build that relationship, that when you get into a situation like this, that you can participate in multiple layers. You can send an email, but you can also pick up the phone and speak to someone in the office and have a significant impact. Anything else on advocacy? Sammy, you're going to say something?
One thing we did this year, because we had a new surgery center and we couldn't do tours because the legislators aren't coming out, we did virtual tours. And so just like you spoke on, Ron, we offered to be an expert resource. And so one of the senators, we gave a virtual tour. And it was actually very cool. He was in the back of his car being driven by somebody else in Washington, D.C. We had his undivided attention for half an hour, so it was great. But he did reach out, one of our senators did reach out and ask about the Medicare cuts because we had spoke to him about that. It gave us the opportunity to talk about all the stuff the current stuff that's going on. And we kept our asks to a minimum. It was just the big things, the Medicare cuts, equitable reimbursement for ASCs, and showed him the cost savings, an ASC versus a hospital visit, the pre-auth burdens, and then when he was looking at the, he was one of the ones that signed on with the to stop the cuts. He did call and ask about that. So it is important if you can establish that relationship and be seen as that expert resource. That is huge.
Great, thank you. Any other comments on advocacy work? I think it's incredibly important because it will help drive the future of orthopedics in a direction that we want it to go. So, Vicki, I know you might not be able to speak to it, but I know the AAOE does have annual advocacy trips. I know COVID has kind of stood in the way of that, but I would encourage everybody to keep their eyes open for the future. Those trips have really been meaningful trips with some great work being done by our, I say our, I'm sorry, I'm not in the AAOE anymore, done by the AAOE.
Yeah, and the AAOE Advocacy Council is very much active. And like we mentioned, we're working closely with AOS and MGMA to make sure that we know what the issues are. And our members on the Advocacy Council are very good about bringing issues forward as they hear about it, talking through issues, identifying them from our Collaborate forum, also identifying issues that might need attention that might start at a state level and then become national. So, I encourage you, if you have questions about anything, whether it's the physician fee schedule or the quality payment program, and you want to know what our position is, we're really working closely with those other two organizations to make sure the advocacy voice is strong from AAOE and we can really work with them. And I think we'll be partnering with them on those Capitol Hill events and things like that in the future.
Excellent, thank you. Alyssa, I think I might turn it over to you to ask if there's any questions that have been posted in the Q&A.
Yes, we have a couple. Oh, one was a thank you. So I'll let you guys know someone posted in saying thanks. We did get a question. So the comment question is, Raider 8 and some other vendors are helping with connectivity into the AAOE data warehouse, also called AAOE Empower. And AAOE has connection into the AAOS registry. So the question is, how does this process work and does it fit into the MIPS registry requirement? Registry for MIPS needs 2 separate registries. If we do this through AAOE AAOS, that counts for 1. What will be the second one we can do? So I think there are a few different pieces into that, really just wondering about the process and if it fulfills the requirements.
So I'll take that. So we do have a connection with the AAOS registry program, and that'll allow you to transfer the patient-reported outcome data that you collect in AAOE Empower into an AAOS registry. So that is a process that we'll work through to support that transfer. And then, the second part of that does count as a registry. The second registry that you would use for that are population health registries. And I don't know the list of those off the top of my head, but we could get that information to you. Obviously, you don't want to have 2 registries reporting your data for the purpose of MIPS, but the intent of that, I believe, is that you have a population health registry that you're using as that second piece. Not know if any of the panelists are using those 2 registries, but.
Right, and thank you, Vicki. And another question that we had that came through the chat asks, is there an opportunity for bracing or other suppliers to get patient satisfaction data with their braces dispensed by the practice? I think this was going back to the patient satisfaction question or topic.
Yeah. I would say, answering from the Raider 8 side, I would say the answer is yes. I'm happy to talk to them offline. I think that, there's different appointment types that can be used to dictate where surveys go. I would imagine it's the same for the AOE data warehouse as well, Vicki.
Yeah, that's exactly what I was going to say. And you're right, it applies to both. It'd just be a matter of being able to identify when those races are being given to patients, and then being able to use that to send those surveys out through whatever system it is that you're using.
Okay.
Perfect. Thank you, guys. We have some additional questions coming through the chat. So the next question we have is, who would be a good resource for discussing the new changes of level of medical decision-making table to determine the best choice of coding with the levels?
Great question.
Yeah.
So the new E&M guidelines for 2021, can anybody speak to those?
Yeah, the AMA has a really good chart on that. And then maybe your EMR vendor might be helpful too. I know ours outlined how they're making changes to the documentations for the physicians. So it's going to make things a lot easier for the physicians.
Yeah, and AAOE did recently host a webinar on the 2021 E&M coding changes, so I can also grab the link to that to send that out, so you guys can grab that there and watch that. That's free for members, so you'll be able to access that. And then, so our next question is, you mentioned the changes with CMS reimbursement. So how have the represented groups prepared their practices for the E&M changes, which are significant to overall revenue?
We've kind of had a, go ahead.
Go ahead, Bill.
We've kind of had a multi-phase approach. So we've been looking at this for a while, but we've had our rev cycle directors sitting with each one of the physician teams and walking them through the changes. The request that's come back is, can you give us, kind of physical examples of what something would look like? And so we're in the process of prepping that. The second is we did kind of, with the announcement of the changes in reimbursement, we did kind of a pro forma using 2019 numbers as to what that would mean for each individual physician or physician team, just to give them some idea of, the overall impact, not just on their Medicare, but their total comp. And that kind of right-sided everybody a little bit. No one likes to see any decrease whatsoever, but based on your percentage of Medicare, it can settle people down or do otherwise.
Especially with the total joint surgeons are going to see the biggest impact. And so we're trying to limit some of the new Medicare, Medicaid patients and steer those to the PAs first. The E&M RVUs are going up, so the reimbursement for E&Ms will be higher, but it does not offset the surgical decline for the total joint surgeons.
I'm afraid to ask, but what happened to the outpatient joint rates with Medicare, with the new fee schedule?
On the surgery center side, the facility side, they went up, but they're looking, total joint surgeons are looking at like a 9% cut.
Wow.
And that's coming off of a big cut, what was it, 3 years ago? Not too long ago.
Mm-hmm. Oh, thank you.
So get your letters written.
Yes,
Yeah.
go back to that link, it's in the chat.
Yeah, the link in the chat will be very, very helpful. Alyssa, are there any other questions?
Yeah, we do have one more question, and this may be more directed to something we can answer, but I'll just read this out loud. So this person says, I'm new to bundled payments. I've taken on more responsibility in these programs, and I'm looking for some more learning tools. Do you have any other, or know of any other webinars, seminars, or websites that can help in understanding BPCI? So for the person who sent this in, I have your name. I'll look up some AAOE resources for you to send over, but I do want to ask our panel just if you have any other additional recommendations or specific resources in mind.
We go to our convener, which is the people that you would end up signing up with to get to participate in BPCI. You can become your own convener, but that takes a lot of resources. So generally, there are conveners out there that you can participate with. So I'm sure AAOE has a list of conveners that are out there that would represent the country across wherever they are across the country, or their specialties, if you will. Is that, Vicki, do you?
We could at least point you in, yeah, we can point you in the right direction to where to find those lists. Yeah, I'm not sure if they're directly on our site, but we can definitely make that happen. So I know where the list of conveners are.
The conveners are extremely knowledgeable and helpful in getting you started. So that's where I would start. And again, talk to if you got a practice, network with some people that are in BPCIA that and they can help you too.
Great questions. Anything else, Alyssa?
Those are all the questions that came in. So it looks like
Okay.
we covered it.
All right, wonderful. Any last comments or thoughts about the future of orthopedics from the panel or anybody?
I just reiterate that the network is the strongest thing that AAOE provides among everything else, and to continue to use each other as sounding boards and things like that. I've only been doing this for a little while, and I found it immensely helpful, and it's been terrific to have the support that I've received. So
Great.
Yeah, that's a great reminder. And we did have a link go into the chat because we have some virtual kind of networking opportunities that we've been doing. So let me grab that link again, and we'll post that back out for you guys. Because yeah, that is a really great opportunity. Like Bill was mentioning, I think we consistently, hear from members that in addition to collaborate, and then those new virtual networking opportunities that we have while we haven't been able to meet in person, definitely something to take advantage of if you haven't already.
And I was just going to comment on the underlying theme. Data is such a big part of the future. I mean, you're going to see a bigger and bigger reliance on data, whether it's patient satisfaction, patient-reported outcomes, and the other quality metrics, and even going into the operational data. So look at what you're doing within your practice and opportunities to compare elsewhere, and then how you're using that data to improve across the board, all the way from improving patient care to the quality of your providers and the market position for your practices.
Great. Wonderful. Well, Sammy, Dawn, Lynn, Bill, Alyssa, Vicki, Evan, thank you all for participating in this. I learned a great deal myself, and very appreciative of your time, and I look forward to seeing you on the next one.
Thanks, Ron.
All right.
Thank you very much.
Everyone.
Take care, everybody. Thank you.
Thanks.
Good day.
Thank you.